Welcome, you guys. Welcome to the second episode of the QOL Health and Performance Podcast. My name is Dr. Joseph Rayner. I'm the founder and owner and also physical therapist for this company. I'm here joined by some good buddies of mine that are also physical therapists as well. So we have Dr. Joseph Nguyen, Dr. Anibal Ramirez, and as well as Dr. Mohamad Marhalim. And today's episode, we'll be talking about powerlifting. Okay, and one of the main things that we'll be going over on top of just like the basic understanding of what it is also kind of breaking down some of the myths behind it. I know there's a lot of like general like public perception of like powerlifting being this like crazy, weird, dangerous sport. But when you look at like the research on like the injury rates of powerlifting compared to other sports, it's actually probably one of the least injurious sports out there. So this would be an interesting topic of discussion, and each of these guys have experience in the sport themselves, whether it be through coaching, through competing, as well as with recreational participation. So guys, if y'all want to take turns introducing yourselves and your backgrounds, and we'll get started from there.
Like Joseph said, I'm Dr. Ramirez Barrios. I'm currently a physical therapist at Houston Methodist Sports and Orthopedics, as well as doing home health and pediatrics. And I'm more of the recreational powerlifter / bodybuilding area realm that I'm in. So definitely love it and enjoy it.
Good deal.
So my name is Dr. Mohamad Marhalim. I'm a physical therapist as well. I actually got into physical therapy from a powerlifting background. Part of the reason I wanted to get into is kind of get into sports orthopedic. Wanted to work with athletes, powerlifters, weightlifters. Coming from my basically, I think part of that's just a lot of different factors. But now I work in home health. I work with mostly geriatric patients. But I used to be a competitive powerlifter. Not so much nowadays. It's kind of just more recreational, just kind of overall fitness.
Good deal.
Awesome. My name is Joseph Nguyen, or Dr. Nguyen, whatever you want to call me. I actually had a very similar background to Mo. So I got in for the same reasons, very similar reasons. But for my background, I'm a physical therapist along with these guys. I'm a USA weightlifting coach, got my CSCS, CEP, whatever, a bunch of letters and whatnot. But what I currently do right now is I do travel physical therapy. So whatever my contract takes me, that's where I work. I also own my own cash pay practice where I do a lot of Olympic weightlifting coaching, things like that. So I'm a USA weightlifting coach. I'm also on the USA weightlifting sports medicine team. And a lot of my background comes with sports and strength and conditioning, things like that. But I do have a lot of also experience with hospital settings, pediatrics, home health, things like that. Just because I believe this all exists on the same spectrum. I think there's a lot of crossover. And it's just, we need to find what common grounds that we have amongst all these settings, whether it's in the PT realm or the PT and the fitness realms, and just kind of find what helps people get better, right? That's why we're here in this profession.
Yep.
But that's kind of
it there. All right, love it. There we go. All right, so so tell the audience here what like kind of got y'all into the powerlifting realm in the first place. What first experience did you have with it, and what moment was it where you were like, you know what, I want to try this out and see how this is like?
So I can start us off.
Go for it.
Oh, yeah, I can start us off. When I was younger, I was overweight, and so I started losing weight, and then I started wanting to get into lifting. And so, I was kind of that bro split kind of guy, just lifting just to look good, kind of not following any sort of program. Was dating my ex. She was the one that actually got me into powerlifting. She was the one that was like, oh, you should try this, you should buy all this equipment, you should try, lifting heavy weights, following a structured program, all that stuff. And that's when I got into powerlifting. That's when I really enjoyed the sport. My mind shifted from, lifting for, I guess, aesthetics, but lifting for overall strength, getting stronger at my body weight, always trying to beat my PRs. It was both a mental, just like a mental accomplishment, as well as a physical accomplishment to be able to lift heavy weights, just like, putting yourself on through like all this physical training to show up and be your best on the competition platform. But that's how I got into it. Nowadays, again, like I said, I don't really powerlift, but it's more just a transition in my mentality in terms of like what I am looking to do at my point, at this point in my life. But I still heavy movement, squat, bench, deadlift. I don't lift to get stronger. I just kind of lift for a general fitness.
Okay. So got me into powerlifting. So back in my early fitness days when I was a personal trainer, I think this was probably around 2011, whatnot. During that time period, one of those days I injured my back doing a deadlift. And I just remember what that felt like, being like I was really debilitated for quite a bit. And honestly, like I bounced back after a week, but that injury kind of left some mental scars that kind of had me more fearful of the deadlifting movements, things like that. Me being a personal trainer, I started, having more nocebic languages to my clients as well. So that was also dangerous as well. But I think a couple months after that, I met a powerlifter in my program at the time. I was in the exercise science kines program, and he was really persistent and trying to get me to do that deadlift again, right? And I was pretty hesitant about it, but he eventually convinced me. So I injured myself deadlifting, I think 245 pounds. Maybe TMI, but I was kind of intoxicated during the time. So, it was a different time period in my life. But anyway, so with the guidance of my buddy, he got me just randomly one day. I picked up 315, and this is like I have not deadlifted in months, right? And just doing that time, I was like, like that didn't feel the same as it did, when I was doing it by myself a couple months ago. Because that particular event had me thinking like, wow, like maybe it's not so bad, right? Skipping a couple months forward, I started, looking more into powerlifting and researching, and how that goes. You go into all the web forums and you see what people are saying about it and things like that, and you start, dabbling yourself, right? So that's whether you're starting to work out or you're going into a new sport, you kind of dabble, right? That's what we do. And so, long story short, I did my first meet, powerlifting meet, and I set it was my second powerlifting meet where I set a state record, right, in the deadlift for my weight class. And it's I can't even explain the feeling where like you were taken down, like a particular event just brought you down to a particular point in your life where you were depressed and you felt like you couldn't do something again, right? To not only doing it again, but for me to set a state record in the event that like injured me, like that was empowering, right? And that was an awesome feeling.
Yeah,
and then
that major comeback story. Yeah,
and that's something that's eventually got me into PT, right? Because that's a sensation I wanted to help other people get, right? To not only like get back to where you were, but just learn, like overcome these fears, these barriers, and just feel like a badass, essentially,
Absolutely. Nice. All right, Anibal.
Mine's kind of like a mixture of both Joey and Mo's story. So I was super overweight growing up. The basic, fat jokes and whatnot. And so I got into fitness just really by being tired of it. Unfortunately, when you're 16, 17 years of age, you don't really know what the hell you're doing. So I'm going there working out with my cousin who's in, varsity football or whatever. And we're sitting there benching like every single day. And it wasn't actually until I think it was like I would say like one of the top biggest dudes at Gold's Gym back in Garland, Texas, G-Town, where he came up to us and he was like, "Hey, I see you guys benching every single day. Like, you guys don't want to look, completely deformed. You're going to be like massive up here, but you're not going to have anything down there." And so really at that point was kind of like when I started doing and looking into doing legs a lot more, but I wasn't really powerlifting just yet. It wasn't until a few years later when I was at UNT from an undergraduate in kinesiology, where I was still somewhat similar. I was more into bodybuilding at the time. So I think I had like 30 people do skin calipers on me, professors and all that stuff. And I think I was in between like 6 to 10% body fat. So doing a lot of just like hypertrophy HIIT type stuff. I mean, I think I was doing cardio like an hour and a half a day after my lifting sessions. And like, it was just crazy. Like, it was just a bad regimen. And so it wasn't until one of my bestest friends at the time, who's still like a sister to me, she was kind of in the powerlifting world, not fully into it, but she wasn't engulfed into it as I am now, but she really was the one that kind of set me straight. And she was like, "You got no legs." She was like, "You got all this stuff, but you got no legs. I mean, look at your calves. It's 97 degrees and you're wearing pants." She was like, "Where's your legs?" And so, Priscilla, I love you. And I appreciate that because you changed my life with that comment. And since then, I was like, God, that's the worst thing you can tell. Like, I'd rather, a girl just reject me and say I'm ugly than tell me I have no legs. Like, I can be ugly, but as long as I got legs, I'm fine. And so really, that was kind of what changed me. And I started looking more into like, I guess leg type workouts, which led me to the powerlifting team at UNT. And I kind of dabbled with a bunch of those guys and girls and talked about it. Never joined, unfortunately, because it was more towards the end of my undergraduate career. And then, of course, went to PT school. But just kind of working out with them and getting to know and kind of building a small little family and kind of learning from them is kind of what led me more into the powerlifting world. Unfortunately, I think one of my biggest regrets is probably never competing. I mean, I think for my weight and my size, I think I would do fairly decent. Not at this age, 28, I'm an old man, but probably back in like 27. Probably, I know I had to throw that out there just a little bit, but I think I would do fairly well. It's just right now with, life and bills and all that stuff, I really don't have the time right now. But I think that would probably be one of my biggest regrets, is never competing, just to see, like Joey said, to push yourself to that next level. Because I'm hitting PRs, I'm doing all this stuff, but I just never did it on a platform. And that's like probably one of my biggest regrets. But I mean, other than that, I'm not like the typical powerlifter. I think there's a stigma about powerlifters that, we all have like that big old belly and we all weigh like 300 pounds. And you can see all of us here. None of us really are like that. And so I'm kind of, I dwell more in the world of like, I guess, powerlifting to hit those PRs in the 500s and 600s and whatever. But I just also want to look good doing it because of the scars from being a kid and being bullied, I guess you can say.
Yeah, right.
Get a little personal. And so I do always care about my physique to an extent. And I'm pretty hard on myself about that, which kind of goes into me being pretty hard on my powerlifting regime. So really, that's kind of what got me into it.
Yeah.
The no leg comment.
I just want to make a comment. I think one of the things that what me and Anibal share in common is in terms of how our female friends, our female friends at the time got us into powerlifting. And there's this stigma against a lot of females out there that powerlifting is going to get you bulky, it's going to get you big, it's going to get you all of this. You're going to be more masculine, And I think it's interesting that at least for me and Anibal, that we had female influences that pushed us into powerlifting,
Oh, yeah.
And I think I think one of the things that, I would love to like break the stigma is the stigma of like lifting too heavy or lifting too much will make you bulky, especially like from, all my female friends who, talk to me about like powerlifting, lifting in general,
Yeah,
100% agree.
I just want to say you're all beautiful. Okay, so I'm gonna say it otherwise. Give them a slap. Yeah.
Appreciate
Also,
it.
like, bro, so it's never too late to compete, bro. Like, I mean,
Yeah.
just make your return as a masters lifter or something, like, yeah,
Oh my gosh. I'll come
I
out there with the Demon Slayer kimono and everything.
that would be awesome, bro. That would be
That would be if I do compete, I'm doing it.
Bro, I would guarantee you, if you competed in a Demon Slayer singlet, you would get. So that's another thing. Most powerlifters watch anime. So
I know exactly.
anyone, I would say I would even venture to say maybe even strength athletes in general. You'd be surprised. I forgot to mention earlier, I helped start the UTA powerlifting team.
Oh, dope.
Yeah.
Oh, nice.
It's a small community. It's not as big as like UT Austin or anything, but
Yeah.
it's
So dope, man.
to help expose, strength training in general. Because like Mo said, like there is still a stigma out there. It's not as bad as it used to be, because I think powerlifting, just strength sports in general, has just, gotten
it's
much
growing.
more.
Yeah, it's getting a lot better. I agree.
Yeah, so there is progress in that, but it takes time. So
Yeah.
And,
You left your mark on there though, so.
You did. Yeah, that's true. And the other thing that's like really important to keep in mind is like the fact that there's different weight classes too, right? So like it's not like powerlifting is totally exclusive to those that are like massive and just like are lifting like a ton. You know what I mean? Like you can literally be like I when I was an undergrad, I had a friend who was weighing like 140 and was competing, and the guy was like hitting state records, like deadlifting, like it was like well over like 400, hitting close to like 500 pounds. You know what I mean? So it's like, you don't have to be some like 200 plus pound dude, like it's like pretty open to anybody really, as long as you get the training in.
And there's also like, there's female powerlifters out there that are like less than 100 pounds, less than 110 pounds, lifting some heavy shit.
Yeah.
Oh,
And,
100%.
Like the stigma of them like being big and bulky. No, it's far from it.
It would be good if we could. I mean, it would have been awesome if we could have gotten someone like in that realm, right? Like I'm
right
in that category to be on this podcast, because get their perspective on that as well. Because I do think
for average sized dudes.
Yeah, I do think there's a big empowering component, and that's why people like it. Like it makes you feel strong. And it just, there's so many benefits to it, not only physically, but like on the mental side of it.
100%.
And I would say that's like most strength sports.
Yeah.
But to also to kind of go on the other side of the spectrum and try to bring it back into like a little bit of like physical therapy related. We have powerlifters who are old, 50 plus years old, up to 65. And, I love it when I try to incorporate, especially with, some of my geriatric patients, obviously, being able to do like some sort of like powerlifting movement, whether it's just a simple squat, a simple hinge type movement, right? That I think those, like it's never like Joey said before, it's you're never too old to get into lifting or powerlifting in general, right? So,
yeah, I had one patient who was like 80 plus year old lady, and she was into like deadlifting and squatting and things like that. And in the clinic, when we were having her rehab her back, I mean, she was deadlifting with the barbell in within a few weeks. I mean, it's just, there's really not necessarily an age limit. It's just more so the limitations that you place on yourself if you're relatively healthy, right? So yeah, I mean, it's a very accessible sport. And also like if you want to compete and you want to compete in a sport where, again, the injury rates are not that high, again, like powerlifting is actually probably one of your best options. Like I was just looking at some research studies on this before we went on this podcast here, and like I saw some studies mentioning how the injury rates would be like one injury out of every 1,000 hours of training. Some studies say a little higher. But I mean, if you look at like, for example, soccer, you'll have rates of like 35 injuries per 1,000 hours of game time, right?
Oh yeah.
So it's a very, very different injury rate again. Like all of us, many of us grew up playing soccer, right? And many of us probably had injuries from playing that sport too. So yeah, it's just, again, like it's interesting how we have this weird stigma on powerlifting of, it's a dangerous sport, when really, like when you look at the numbers and the statistics on it, it's probably one of the safest sports out there.
Yeah.
I don't know.
I think also tacking on to kind of piggybacking on what Joey said, the mental aspect. So like another realm of medical practice. I know from far powerlifters seem very intimidating, but honestly, I think the powerlifting family is like one of the sweetest and most welcoming community that you can ever join. Like every powerlifting gym I've been to, I've met lifelong friends, follow them on Instagram. We keep in touch every now and then. Like they're super welcoming, they're super motivating. Like they're just overall just awesome people, because they're basically, a lot of them are there for the same aspects of a lot of us. Like they're wanting to feel better, they want to look better, they're wanting to hit those PRs, they may look like big old beasts, but like, I mean, it's funny to say, but they're just like big old teddy bears, really. Like they're just the sweetest family, the biggest motivators. They're gonna be your biggest supporters.
Yeah.
When you're going for that PR, like you're gonna have a dude come up, and if you want him to slap you on the back 2 or 3 times and sit there and scream and record for you, like it's the biggest family. So I mean, if anybody that's looking to get in powerlifting, I mean, I think the biggest thing is go to a powerlifting gym and just join and just make friends. They're gonna become your family. Like y'all are gonna hang out outside of the gym. Y'all are going to do stuff together, go to events, go do all this stuff. And so, I mean, I think honestly, the biggest stigma is like, they're not monsters. Like they're actually really genuine, nice people that are going to support and motivate you throughout that journey, which I think is important, which is something I wish I did before going to UNT, was like join a powerlifting gym and make that family connection back home.
Right. Exactly. Yeah. So I think that gives us a good point to kind of talk about sort of entering the sport of powerlifting, right? So like, if y'all want to discuss a little bit about like training methods, like rep ranges, overloading and deloading weeks and all that stuff. Joey, I'm hoping to kind of pick your brain on this part here, because I know you're actively, doing the coaching scene and you're still competing and whatnot. So I don't know if you want to share some ideas as far as like for beginners, I guess, per se, like what that can kind of look like, and then how that can progress over time as you get more experience in the sport.
Sure. So for clarification, I am currently more in the Olympic weightlifting realm right now. So I do more of that, but I was a powerlifting coach a couple years ago.
Mm-hmm.
There's a couple overlap, but basically just your general strength and conditioning principles. You kind of start off, pretty easy, nice and slow. It's like an introductory phase, right? Because you want to not only like dabble with these movements that it's kind of like testing, right? So like we're comparing it to PT. You're getting to know yourself or the patient, right? And what you're able to do, like that first 1 or 2 weeks, right? You're kind of assessing, so that way you can have more, you're gathering information and data moving forward, right? So, but at the same time, you're using that time period to also kind of start building your capacity and tolerance, right? So, you're scouting initially. At the same time, you're accumulating volume and practice reps, right? So, there's a little motor learning component in that realm.
Mm-hmm.
So you're doing that for a couple of weeks, and then you start. This could be different for everybody, right? So generally, 4 to 6 weeks is kind of like the first, what we call it, like a mesocycle, where you just kind of, I wouldn't say like play with like light weights, but I would call it accumulating volume and reps, right? So take it how you want to take it. And then gradually you start challenging yourself a little bit more, whether that's increasing your range of motion, increasing your weight percentages, whatever. And generally, if you're going to increase the weight on the bar, you generally kind of reduce your reps that you're doing per set. I mean, that's not always the case, because I don't believe in absolutes, but like really depends on what the goal, the intent of that training block is, right?
Mm-hmm.
And generally towards the end of the the training, let's call it the macro cycle, right? The training, everything is when you kind of test your limit, your capacity, right? But it's not like you jumped straight to that point. Like you've had weeks building up to this point.
Exactly.
Right? That's the thing about not only powerlifting, but just like getting stronger in general. It doesn't happen overnight. You take steps to that point, right? And that's the thing. Like people see all these heavy weights, but it's like, we didn't get there, in like 1 week, right? So whether it's practice or you're just getting stronger, which is that's the thing too, right? So, or just learning how to do things more efficiently because you kind of had time to dabble, right? It's probably a combination of all of that, to be honest. But that's kind of like what a general resume look like. I have actual powerlifting coaches as friends who probably know a little bit more in that realm. But that's kind of like the general.
Right, exactly.
One thing I want to take away from what Joseph was saying is that, you can kind of also apply it into, PT or the rehab setting as well, as that you can't go from point A to point B within a certain amount of, like a specific amount of time, like within, like 1 or 2 weeks, right? A lot of our patients, they have this idea that like they want to get quick, like better, faster, right? It takes a while. It's going to take a while to get back to whatever they want to get back to doing, whether it's lifting, whether it's running, et cetera, right? And to go back to what Joseph was saying, like, yeah, you have these like mesocycles and then these macro cycles, and you can basically apply that to the rehab setting, the rehab field as well. But to kind of like go back in terms of like keeping it simple, especially like for beginners, even like for our patients, right? Just the simple progressive overload of like linear progression, whether it's increasing reps, increasing weights, increasing range of motion to to their pain, within their pain tolerance. That is probably like the best way to kind of get into rehabbing or like lifting in general, even powerlifting.
Mm-hmm. Yeah, not just rehabbing, but also like injury prevention as well, I would say. Like, kind of like what Joey was saying, like you're not going to be trying to start powerlifting for the first time and then try to hit your 1 rep max PR within like 1 to 2 weeks. Like it's a gradual process, and you want to take it slow and consistent, because like for example, like I think I saw like the majority of injuries that do happen in powerlifting are more so like your acute kind of injuries, like, oh, you pull your back or something else happens, right? And then after that, then there are still a fair number of people that have injuries that are more chronic, or more of like your like overuse type of injuries and things like that. And that honestly, a large part of that is your programming, right? Like, do you have a proper program? Are you benching, squatting, or deadlifting like too much in the week? Are you recovering properly from that? You get enough sleep? You dieting well enough? Like there's all kinds of things involved, right? So again, like there's a lot of like crossover between like the rehab world and strength and conditioning world in that sense, where if you're trying to progress someone in the programming world, like strength and conditioning world, it's a gradual process, and you got to look at all things. When you're trying to rehab someone, it's a gradual process. You got to look at all things, right? So it just kind of it overlaps a lot. So I just want to throw that out there, because it's important for people to know. Like there's a very fine line between like the physical therapy world and strength and conditioning world, in my opinion, in that sense, right? I don't know if y'all agree with me on that one, but that's just what I've noticed.
Oh, totally. Because what I see in the clinic, and I'm not going to call anybody out or anything, but like people sometimes look at me weird when I get my 60, 70-year-old lady in a hex bar. And I'm like, why not?
Yeah, for
like, give me a reason why not. If it's within safe limits, there's no restrictions, like none of that stuff. And she's wanting to get down on the floor and pick up her puppy or pick up her daughter, or her daughter, like, niece, nephew, whatever. Like what's the movement that they have to do that? So one of the biggest things that I tell my patients when they tell me, I walk every day. I'm like, okay, good. What else do you do? Like that can't be the only, like walking's not going to get you up off the toilet. Walking's not going to get you in and out of your car. walking's not going to get you up and down the stairs. It's great, keep doing it. But what happens when your niece or whatever wants you to pick them up from the ground, and you reach down and you haven't done a squat in years, whatever the case may be, and so I get my elderly patients, like Mo and Joey and you said, strength and conditioning and physical therapy really overlap quite a bit.
Mm-hmm.
And so I do a lot of the stuff that I do in the gym, I do to a lot of my patients, regardless of age. Like, of course, I'm not going to get an elderly person to do a single leg RDL, but, unsupported, but I'm going to get them in a bench. I'm going to get them, or not bench, but I'm going to get them under squat rack. I'm going to get them in a hex bar. I'm going to get them to do, goblet squats, like different type of things, because that's movements that they're going to have to do outside, in an unsafe environment where at least here they can be monitored. And so exactly. I think it's important for everybody to do in general.
Exactly.
And
100%. I agree.
I'm tired of PTs, even though it's funny, it's a joke between us PTs, the 3x10. I see it a lot.
Yeah.
Like 1 week I'll see, because I'm PRN, so I see just everybody's patients like everywhere. Mm-hmm. And I look, when I'm chart reviewing, I look at notes and I see that they had them do a sit to stand with a 10-pound weight, 3x10. And then the week after, it was a 6-pound weight, 3x10. And then the next session was a 12-pound weight, 3x10. And I'm like, where's
yeah,
like Mohamad said, the linear progressions, like you're upping the weight, you're downing the weight, but you're not changing any of the reps. How long is their rest time? Because are you giving them rest? Because a lot of times I see them just do it like right back to back to back to back to back. So I think it's an aspect in PT that just really needs to be addressed. And unfortunately, it wasn't in my program, and I don't know about other programs, but I think it's something that really needs to be addressed. Is the strength and conditioning aspect in physical therapy, because a lot of it is really the same.
Absolutely, I agree.
That's why I'm a coach.
There you go.
I might be deviating a little bit, but I think how we frame, let's not even call it powerlifting. Let's just call it resistance training, because it's like there is stigma in resistance training, like Mo mentioned earlier, whatnot. But I think how we frame, like how we introduce these movements to people, like that's important as well, because powerlifting might sound a little intimidating to some people. Yeah. Mm-hmm. So if you can just relate it to some functional task, whatever they enjoy doing, I think that helps get some buy-in as well. Mm-hmm. Right? Because for the most part, powerlifting is a functional sport, right? So squat, deadlift, or hip hinging, whatever. Bench press, debatable,
Yeah.
But we can usually attach to something that they do on a daily basis, and that comes, since we're all PTs, this comes with the subjective, right? So right. we learn about them as a person, what they do on a day, what they like doing too, because I think we can attach it to things that they enjoy doing or what they used to enjoy doing, that we can help them, guide them towards those steps, right? And obviously there's the functional aspect of it, but there are physiological benefits of it too, bone density and all that fun stuff.
Yep.
We don't have to really it could be a fun fact that we tell them, but it's just kind of at the end of the day, it's the higher your capacity to just handle stuff, the more opportunities you have in your life, right?
Right.
If you can deadlift 400 pounds, right, you can play with all the kids that you want, probably. Basically, carry all the grandkids on your shoulders and whatever. But it's just, I think at the end of the day, we don't want people to become feeble vegetables, whether that's from an injury, from getting older, just getting busier in life, whatever. It's try to, because one of the biggest things in America, and I'm, like I said, I'm deviating, but one of the biggest things I see in the US or whatever is just all these preventable comorbidities, right? So let's try to introduce strength training or fitness in a way that works for people's lives, you know.
Yeah.
But whatever.
Yeah. No, but that's a whole nother like podcast right there is talking about that. But
Yeah.
no, for sure. I agree entirely. It's just like, you know, relating it back to the person in their like, you know, specific life, and, you know, still being able to incorporate some form of training that will help them be resilient to the effects of aging and whatnot. So yeah, absolutely. I agree entirely on that.
Yeah.
Let's see. All right. So I think what would be good to like jump into next is like tackling some other myths that are in the powerlifting world, or, you know, speculations and whatnot. So let's talk a little bit about, like, for example, with the bench press, with the back arch, and, you know, the technique behind that and reason why that is. And, you know, because a lot of people will say like, oh, that's just cheating. Like, oh, that's just a bunch of BS. Like, why do they count that? Why is that a thing? I have my thoughts as to why, but I'll let y'all kind of jump in and give some thoughts, and I'll jump in however I need to and whatnot. So whoever wants to take on that that elephant in the room there.
I say Mo.
Personally, I don't think like an arch is bad in terms of like bench pressing. I think it helps just stabilizing, you know, your body onto the bench, gets your shoulder in a good position. Now, as far as like how much you're arching, you know, there's always going to be extremes. There's always going to be too much, you know, too much lumbar flexion when you're deadlifting, too much thoracic extension when you're lumbar flexion when you're deadlifting, too much thoracic extension when you're benching. You know, I just think that it should be in, you know, a moderate level, you know, of if you're going to go back to like benching, I don't think there's a, you know, a big issue around it.
Yeah, because it's like you're saying, like, I think one of the most important things behind the arching is, first of all, to stabilize. Like, you know, if you're looking to maximize your lift, you want to make sure things are secure while you're doing that, right? No, for sure. Yeah, absolutely. And then like, yeah, like the range, you know, because some people have more range than others, right? So that's where that gets it into a little bit of a gray area where it's like, okay, so what is appropriate, you know, arching in the back? So I kind of agree in the sense of like, you know, keeping it fairly moderate. Like some people are going to be able to arch like crazy, and it's going to decrease the range of motion a lot. And then there's going to be those that can't really arch that much, like myself. And so, you know, I can't really take advantage of that. But I mean, you know, there are definitely standards.
Well, the thing is, I think the thing that, you know, you see these videos of like these lifters arching so much, and then like their range of motion in terms of like benching is so little. The thing is that like, you know, people call them out for that. But the thing is that people have to realize that that's still like, that's still pretty heavy, like for, you know, to be able to bench that and to be able to do that with a technique, to be able to reach to that point there, it still takes a lot of training, right? You know, people don't realize it. It's like, yeah, your range of motion might be a little, you might be arching your back, it might be called cheating, but there's, you know, you have to still get to that point. It's not like
you still can't just jump into that tomorrow.
It's not like you start arching your back and then you widen your grip and you can start benching 3 plates. No, it's not like that at all, you know?
Yeah, exactly.
I wish it was, but it's not.
Right.
Because I'd be benching like 600 right now. So my perspective, I mean, I agree 100% with Mo, what he said. I don't think it's cheating at all. It just basically is to help stabilize, get a little bit more tension just globally in the entire body, so you can utilize your core, your legs for that push, as well as the push with, you know, your arms and your upper extremities. And so, I mean, my rule of thumb, like Mo said, keep it moderate and keep your butt on the bench, and you're good.
I think people will complain about that, or haters.
Amen. Amen.
Yeah, I mean, I think people
out.
But anyways, so like that's an interesting topic. So I think, yeah, going off the stabilization thing, it helps with the force transfer for your leg drive. Let's call it that. I don't like calling it leg drive, but like leg, um, lower body assistance. Let's just say that.
Sure.
Because technically, you know, I'm not even gonna go into the route of like technique stuff, but generally when I teach people bench press and whatnot, it's like you don't want to do that hip thrust when you're benching. You should have constant tension, like from your foot to your upper body, right? So
Exactly.
and I think most people who complain about it, they don't really use like drive. They're the ones who like do a little dance when they're like benching and stuff, and the butt comes off and all that fun stuff. So
Yep.
which, by the way, for people who don't know, your butt is not allowed to come off the bench when you are doing a bench press for powerlifting standards. You have to maintain 5 points of contact, which is the butt, your upper back, your feet, right?
Mhm.
And then we start kind of going into like federations, right? So USAPL, your feet has to be on the like completely on the floor. USPA, you can be on your tippy toes, things like that. All these other stuff. But like you know, I think it's most of the haters are also like some of the old heads who are like the stereotypical, the old stigma of what powerlifters are, like the big boys with, you know, weigh like 300 pounds, and you know they already have like that mass where, you know, that range of motion isn't as much, right? And so they get upset when people are recreating this and not being, you know, as the same as them, right? And that's the thing, like if you can recreate the same effect, you know, then what's the issue, you know?
Exactly.
At the end of the day, powerlifting is a performance sport, and so whatever gets you to your end goal, right? That's what matters, right? So now when I see like a ridiculous, like I actually have a buddy, he's what I think 74 kg, benching like over 400, you know. Yeah, so 74 kg, I think that's like 160 pounds or so ish area. So you know, when I see that, I get a little salty, but you know, it's like personal reason. It's not because like I think that's stupid. I think it's like, damn, I wish I could do that, you know.
Right.
So
yeah,
you know, I'm a shot.
Just arch your back more, man.
Yeah.
Just arch your back more.
Yeah, I hear you. I'll do some more twerking classes.
Oh my God.
Throw that button in something, man.
And then the other point I wanted to bring up too is like with the rate of shoulder injuries that are present in both like powerlifting and weightlifting, typically those occur in positions that are considered like extreme, right? So like like for example, we'll jump into weightlifting for a hot second, like with a snatch. So when you snatch, you have, you know, full abduction and external rotation. You got a lot of weight on top of you. You are potentially at higher risk of injury in that position compared to, you know, if you're in the clean kind of position here, right? So just as an example of that. And then with like the bench press, which is what we're talking about right now, you know, when you have that decreased range of motion in the bench press, you know, what that allows is for you to be able to hit your endpoint before or with less shoulder extension, right? So again, there's a sense of that being a bit more protective, I guess you could say. You know, debatable, I guess, because you know, again, you have to be trained to carry that weight regardless of the range of motion, and you have to be able to train in that range as well. So give or take what I'm saying there, but basically, like, you know, because of that positioning of the shoulder, I would say you're probably also less likely to get injured with the arch on top of being able to stabilize more. And so all that combined just allows you to lift more and allows you to stay healthier is bottom line what I'm saying, right? And again, that could be debatable with some people, but that's currently my understanding of that, at least.
Yeah, I would say it's like not necessarily like positional stuff is part of it, but like at the end of the day, it's more so about like exposure, right? Is this person ready for this particular movement,
Yep.
right? And how much exposure have they had doing that particular movement, whatever range of motion it is, right? Whatever position it is. Because you know, and that's, I don't want to get people afraid of, you know, doing things a particular way. You know, everyone's going to do things a certain way, whether that's because of their body structure or like that's just how they do it, or maybe it depends on where they are in their training career or fitness journey. You know, everyone's going to do things a little bit different. At the end of the day, it's more about, I would say, consistency and you know, just how do I word this? Good quote. Basically, I was just gonna say like being smart, but like that's very vague. So like,
no, but yeah, I mean, being smart
don't ego lift.
is covering the stuff that we already talked about. So like you said, like, you know, programming appropriately, not jumping straight into your max weight, like building up to it. You know, making sure, again, like how I said earlier, like your recovery, you try to optimize that as much as possible. So yeah, like, you know, just being smart about it, which it's, you know, I understand why you said like being smart is a bit too vague, because to someone who doesn't have a full understanding of what we're talking about, that can be confusing. But yeah, at the end of the day, you know, again, it's just following the fundamentals basically and staying consistent.
Yeah.
So yeah.
That and doing a freaking warm up, because no one ever freaking warms up, man.
Warm up, yes.
You just jumping in the 2 plates on the bar, just straight as 37 degrees outside, and I see them walk in shorts and go straight 2 plates on the bar and start squatting. I'm like, what are you doing? So
that's rough, man. That's rough.
that takes guts, because I'm not doing that. I'm not doing that.
That's tough.
And so yeah, I agree. Fundamentals, don't ego lift, and freaking warm up, and you'll be fine.
Yep, there you go. All right, well, I think we covered enough points for today. So I'll go ahead and ask y'all if you want to give any kind of final thoughts or final send off to anybody who, you know, may be interested in the powerlifting world, and, you know, what kind of advice you want to give to them, or any other thoughts there.
Hit my boy Joey up. Let him coach you.
Hit up Joey. Exactly.
Hit up Joey. Let him coach you. He'll train you well. And he'll teach you to dance too at the same time. So
there
you go.
It's a special deal. Okay?
That's what I'm saying. I don't know how much more, but there'll be some dance lessons.
If you're trying to learn how to do them TikTok dances, hit up my boy Mo.
There.
No, I guess my last point is, I guess at the end of the day, if you want to get into powerlifting, you know, have a reason to why you want to get into powerlifting. I think in general, just getting into resistance training, well, whether it's powerlifting, whether it's weightlifting, whether it's just light lifting, it's gonna help you in the long run, especially as you get older.
Yep.
Yeah. I think my biggest thing would just be, honestly, just go to a powerlifting gym, you know, meet some people, make some friends. That's going to go a long way, because they're going to motivate you.
Get a mentor, get a coach.
Get a mentor. Yeah. So like, even if, you know, you can't afford 100 sessions, you know, just getting 8 to 10, 4 sessions, you know, once a week or something, just so that they can teach you at least the proper, you know, biomechanics and form on how to do different things. And then on top of that, going and making friends and making a powerlifting family, like they're also going to guide you and help mentor you. So I think if anybody's interested in powerlifting, like I think the biggest thing would just be like going to a powerlifting gym and getting a feel for the people there, because it's one big family, to be honest.
Cool. All right, y'all. How can the audience reach out to you if they ever want to hit you up or follow you on social media and whatnot?
I don't even know my Instagram handle. I mean, my email, Anibal, my first name right here, I'm sure you guys can see it, Ramirez94@hotmail.com. I think will be probably the best method.
Cool.
Just hit me up on Instagram, Mo Amplified. I check that Instagram like every day, so it's easier. I don't even check my mail.
Oh my gosh.
So I have a couple of outlets you can reach me out at. My personal Instagram is Dr._PhysioJoe. My business one is Ford Physio Fix. And then my email is joseph@fordptfix.com.
Sweet. All right, guys. Well, appreciate your time this evening. And, maybe I'll hit you up again, maybe for the weightlifting episode, or maybe we'll do a second one. We'll see.
Yeah, for sure.
Thank
For sure.
you.
I'll be down, man.
All right, y'all. Peace.
Appreciate it, man.
You're beautiful.